Welcome to the Student Nurses Media School. Please subscribe my channel by clicking subscribe button below and bell icon for notification. Today I am going to deal on role and responsibility of mid-level healthcare provider. Developing countries like India has double burden of disease and community level healthcare services are very poor. To get over with health issues, the country requires healthcare professionals and healthcare facilities for providing required healthcare support. The community health officer is new step by Indian government which comes under mid-level healthcare provider as per new NMNC bill. They are called community health providers, an ideal health workforce which is multi-layered, multi-skilled with complementary roles delivering competent, comprehensive, continuous and compassionate care. India needs mid-level healthcare provider in several forms: nurse practitioner, physician assistant, and community health provider to fill the vast gap of easy access and quality in health services. They are especially required for primary care. Come to the definition of mid-level healthcare provider. Mid-level healthcare provider is defined as a health provider who is trained, authorized, and regulated to work autonomously, who receives pre-service training at a higher educational institute for at least 2 to 3 years, whose scope of practice includes, but it is not restricted to, being able to diagnose, manage, and treat illness, disease, and impairments, including perform surgery where appropriately trained, prescribe medicine, as well as engage in preventive and promotive care. We'll see one more definition which is given by Srikant Desai. Mid-level healthcare is defined as frontline health worker in the community who are not doctors but who have been trained to diagnose and treat common health problems, to manage emergencies, to refer appropriately, and to transfer the serious ill or injured for further care. Come to the background of mid-level healthcare provider. The primary objective of healthcare is preventive approach to any epidemic, and it can only be achieved when entire community is empowered. The empowerment of people from different community is global, is a need and due to shortage of healthcare professions, there is a workforce barrier to overcome. The community health officer will identify the needs of community and expand the healthcare facility with providing knowledge and support organize different programs. Need for mid-level healthcare provider in India. Around 11.5% households in rural area and about only 4% in urban area are not receiving any form of OPD care at subcenter, primary health center and community health center level. This indicates the low utilization of primary health care for minor elements, or it may because insufficient healthcare services or unavailability of healthcare providers. In order to expand access to comprehensive primary health care, Government of India has launched Ayushman Bharat Pradhan Mantri Jana Arogya Yojana in the year 2008 September. PMJY is centrally sponsored scheme. Under this scheme, Health and Wellness Center, Subcenter and Primary Health Center are being strengthened as Health Wellness Centers, that is HWCs. The service in HWCs will be provided through mid-level healthcare provider, also called as county health officer, placed at health and wellness centers. The mid-level healthcare provider or a community health officer will undergo a certificate community health through IGNO or public university. Taking stock of current experience with mid-level providers, over 100 years, different category of mid-level healthcare has been successfully to provide healthcare, particularly to underserved communities, and their thrive to use has been widening in both high and low income countries. Although the scope of these cadres can be considered similar, there are wide variations among the countries regarding this job description, content, duration of quality of training, and the framework within which they work. Mid-level healthcare provider mentioned above shows that improving access to a coverage of health services and that often well-trained and motivated mid-level workers provide superior quality and more accessible service than better qualified but less motivated professionals. Mid-level healthcare providers also play an important role in scaling up access to HIV service. The introduction of mid-level healthcare provider has been met with resistance, reluctance from powerful lobbies and professional associations. The resistance may be motivated by misperceptions such as lowering standards of care, fear of increased cost due to the excessive prescription of diagnostic and curative service, and the risk of replacement of traditional carers. Sometimes the name itself, example physician assistant, may denote contribute to a tension between mid-level healthcare providers and traditional carers. Mid-level healthcare has been formally investigated. There has, however, widespread of understanding and appreciation for vital role they played in providing essential health services. Improving the access, inequities within countries in relation to the availability of health worker are acute, and this is arguable a more important problem than absolute storage shortage of national level. The maldistribution particularly acute for countries affected by heavily burden of maternal and child death. According to the most recent countdown, in the review of 2015 predict the median density of physicians, nurses and midwives is 4 times higher in urban area than in rural area, with important implication of equitable delivery of services. It has been suggested that mid-level healthcare provider may represent a solution to providing service with more qualified staff or different to recruit and retain preserving the qualities. The use of mid-level healthcare provider is that because of the shorter training and lower qualification, this might provide lower quality of care than traditional healthcare provider. Some caution explicitly against the establishment of two-tier healthcare system with services of urban area provided by physician and lower quality healthcare provided by mid-level healthcare provider in rural and disadvantaged area. Linking the quality and equity concern, these objections relate also to the risk that such as system would be perform skewed allocation of financial resources as urban based medicality would be likely to capture large proportion of public funds, thereby enriching inequities. The quality of care should be fit the needs of the patient, cause no harm to the patient, be right for the patient, correct diagnosis and treatment that is evidence based, be given without unnecessary delays, include all the necessary medical tests and procedure for the specific diagnosis and treatment, be fair and not affected by gender, religion, language, age or income. Come to the education record for mid-level healthcare provider. The role, skill, and management practice vary substantially across careers of mid-level healthcare providers and countries. Mid-level healthcare providers have been modeled on professional cadres such as medical doctors, pharmacists, registered nurse, environmental health officer, etc. Asian countries have over the year developed a large number of local mid-level healthcare provider categories from birth attendants to health assistant who are not modeled on traditional health professionals but responded to the specific country needs. Come to the qualification. Qualification record for mid-level healthcare provider is BSc Nursing or equivalent as qualification from any institution recognized by State Indian Nursing Council. Preference will be given to the candidates who have passed MSc Nursing from the institution recognized by State Indian Nursing Council. Experience and age. Experience should possess a minimum of 2 to 3 years experience as a staff nurse in a clinical setup at primary, secondary or tertiary level healthcare facility. Past experience of working with a government health setup will give a preference should is expected to have leadership qualities and will be able to lead health and wellness center team. Nurse nurse mid-level healthcare provider or community health officer should be below 40 years of age and medically and mentally and physically she should be fit. Training program for community health officer, certificate program of community health, it's about 6 months duration. Training program of new health policy 5 to 7 days every year. Digitalized application training program for 3 days and regular training from eco platform. Come to the role and responsibilities of mid-level healthcare provider. Community health nursing officer is evolving concept in healthcare sector and their role and responsibilities are purely population oriented in public health. They are expected to provide specific services, delivery, leadership, supervision, management, and take proactive roles in all the activities at community level, organize various health programs, and activity in health promotion according to the needs. These roles of community health officer help to bridge the gap between the healthcare facility and population seeking health care. The responsibilities of mid-level healthcare are grouped under healthcare services, administrative and supervisor services, and other skills. First, we'll take up healthcare services. The healthcare services includes first one maternal health care, prenatal care like antenatal checkup, screening for high risk, immunization, supplementation, childbirth, postnatal care, and if required, referral to higher center. Neonatal and infant health care, management of high risk newborn, screening of congenital anomalies, IMNCI service, immunization. Childhood and adult health care, adolescent health counseling, identification of drug abuse, detection of any deficiencies, nutritional supplement, and referral services. Next one, reproductive health care, family planning, prevention and management of sexually transmitted infection, identification of gynecological problems, and referral service. Communicable disease, diagnosis and treatment of vector or waterborne disease, provision of DOTS, and disability prevention and medical rehabilitation service for leprosy along with referral service, illness and minor elements, identification and management of fever, respiratory infection, diarrhea, cholera, skin rashes, pain, typhoid, etc. Non-communicable disease, screening, prevention, control and management along with follow-up and maintenance of treatment modalities. Eye and ENT, screening along with primary care of ophthalmic and ENT problems and referral services of any emergencies. Oral health, regular checkup and screening for oral health. Geriatric and palliative care, organizing health camps and routine health checkup. Emergency services for burns, injury, trauma along with first aid management. Mental health care, conducting screening and counseling with referral services. Come to the next role of mid-level healthcare provider, that is administrative and supervisory service. Administrative service, guidance to the other co-health worker, maintenance, inventory, report submission, supervision of national health programs, ASHA worker, home visit, health promotion activities. Care pathway provides specific care according to the standards of treatment guidelines. Case coordinator and manager provide communication to the higher authority regarding specific cases, coordinating care and management of care. Disaster and outbreak of disease, local response to the disease outbreak and early management of disease. Fund management, support the team for entitling the funds for various projects and programs. Data management, recording population data with various health indicators and communicate it. Environmental role, education to the community, speaks about safe water, sanitation, disposal of waste, pollution control, and identify environmental hazards and control. Other skills includes communication skills, interpersonal relationships skills, transcultural competency, assessment skills, training capabilities, professionalism, adequacy, education, and facilitation. Next, regulation and management. Health policies, specific health legislation, accreditation cadres, and accreditation of teaching institution is, in fact, form the basis for regulation of framework in the area of healthcare, critical element in maintaining quality standards. In turn, social and political recognition of these cadres as well as their political for association and recognition depends on accreditation and legislation. In resource poor environment, these issues are sometimes neglected, and this is particularly evident in case of non-traditional cadres such as community health worker and mid-level healthcare providers. Come to the conclusion, mid-level healthcare providers are a frontline workers who work at sub-center level and provide primary health care. Thank you.